India is reporting a surge in COVID-19 cases again. There are two new variants, the NB.1.8.1 and LF.7, both sub-lineages of the Omicron variant that have been detected in India lately. There are fresh cases that have been reported from Maharashtra, Karnataka, Andhra Pradesh and Delhi, with Kerala being the worst hit, having reported 273 cases in May alone. The Union Minister has said that it remains vigilant and proactive in monitoring the situation closely. The World Health Organization has put this variant at low risk but warned about the transmissibility of it. Advisories have cautioned people to abide by the COVID precautions but not panic. Let's start this conversation, find out more about this new variant of COVID that is spreading fast across the cities in our country, especially in Karnataka and in New Delhi, Kerala, Andhra Pradesh. Joining me on the telecast is Dr. Sanjeev Bagai. Dr. Bagai, first of all, this sudden increase in the number of COVID cases, the newest variant that has been detected, and there are a large number of people that have been infected by it. How cautious should we remain?
Good evening. So I think COVID has always been there. It's been there for the last 5 years, even after the last wave of the initial phase of Omicron. Various sublineages have come up from time to time. Internationally, more than 1,750 subvariants have been known and isolated. The one in India, which is being isolated right now, is JN.1. This is not a new variant in India. It had also shown to be diagnosed around 6th of October 2023 in Tamil Nadu. So what JN.1 is, it's a breakaway of the BA.2 family of Omicron. It either transmits and evolutes from the XBB strain, or it can add what we call as a flip variant, which is LS455, and become what we call as JN.1. During this mutation, this extra mutation on the spike protein, what this does is it has more transmissibility at the cost of decreased binding to the ACE receptor. So therefore, it can transmit from human being to human being a lot more, but the infectivity, the lethality of it goes down. So it's a trade-off. But more importantly, this is perhaps one amongst the most immune escape mutations which we have known in JN.1. And when I say that it is one of the most immune escapes mutations which are there in JN.1, the reason is that it has gained a lot of unique mutations apart from the flip mutation, but it has lost approximately 24 selective mutations. What this has done is that it has created an ideal recipe in which you can have vaccine escape infections, or past infections don't give you that much amount of natural immunity as herd immunity. So the bottom line is that we have to be cautious. We should wear a mask in crowded places, especially in summer months when we are traveling. We need to take adequate precautions. Remember that this is an airborne infection. It is not lethal. The hospitalization rate is very, very low. The case fatality is near nil at the present moment, but precaution is always better than being sorry at a later stage.
Okay.
Lastly, what I want to mention is that when you say in terms of getting a subclinical infection, or indeed a mild infection, or an asymptomatic carrier status, you are still susceptible to develop long COVID. So long COVID is an entirely different chapter, but it exists worldwide in about 20% of people who've been exposed to it. Cognitive effects, kidney, liver damage, eye infections, a host of systems are involved. So it's best to prevent this infection.
Okay. More importantly, how would an individual be able to escape themselves from this latest mutation? Can there be more vaccines that can be administered to a person, or precaution is the best offense?
So in terms of the vaccines, India is extremely well placed with a population of 1.4 billion, which is about 145 crores. We've given 220 crore vaccines all put together. Almost 95% of the eligible susceptible population has been vaccinated twice. The boosters to the elderlies and the people with comorbidities has been given. So over a period of time, you develop what we call as a cross-reactive protection, and over a period of time, a community-acquired immunity. So we are reasonably well placed. The newer vaccines which are available are what we call as the bivalent vaccines, or what we call as target vaccines. So JN.1 vaccine is available internationally, although it's an mRNA vaccine. But at the present moment, we don't need to think of vaccinating for this particular strain in India. We don't need to keep any antivirals. We don't need to be thinking of hypoxia and oxygen demand. But the hospital systems are well geared up. They've been told what to do. The Indian healthcare system in the last 5 years, although has been extremely robust and good, is extremely well driven by systematic scientific protocols.